Good morning, everyone. My name is Tammy Nelson, and I'm an epidemiologist here at the Marion County Public Health Department. And it is my great honor to welcome you today to our Opioid Safety and Alternatives Conference. None of the Planning Committee members or presenters have any relevant financial relationships with a commercial interest or any unresolved conflicts of interest to disclose. You may, however, view our disclosure grid by clicking on the link found in the Financial Disclosure section of our conference homepage. Now, before we get started, we have a couple of housekeeping tips. Number one, you're watching me now, which tells me that you have mastered the agenda. Just know that throughout the day, you can always navigate back to that agenda page and click on any active session. Now, all of our sessions were pre-recorded in the week before the conference, but after the pre-recorded segment is over, we will have a live Q&A segment with the presenter. You do not have to wait until that Q&A segment to present your questions. Instead, at any time throughout that session, you can scroll up and enter your question or comments in the chat box just beneath the viewer. Then the presenter will see those comments and be able to address them during the Q&A session. Now, Marion County Public Health Department entered a joint providership with the Indiana State Medical Association, or ISMA, to ensure that each of you could earn continuing medical education units for your time spent during our conference today. We have utilized a couple of tools to ensure that we could provide documentation necessary to ISMA so that they could provide you with your certificates. The first tool that we've adopted is the use of engagement questions. Throughout each session today, you will see 2 to 3 questions pop up. They're simple questions. 2 + 2 =, hey, are you still watching? Now, your answers to these questions don't matter. What actually matters is that you respond to the questions. And it is in that manner that we can look at your engagement and make sure that you are still watching the videos. The second tool we've used is an exit survey. You'll notice that on the last agenda item is a link to this exit survey. Now, regardless of your interest in earning CMEs, we ask that each and every one of you please complete this survey. However, for those of you who are intent on receiving CMEs, the survey is not an option. If you do not complete the survey, you will be ineligible for CME units. The survey takes about 5 minutes, so I encourage each of you at the close of the conference today to please visit that last agenda item, click on the link, and submit your survey right away. If you choose not to do so, just keep an eye on your email, and when you get the link, go online and complete the survey at that time. You must complete the survey before the deadline, though, and it is a hard deadline, so it must be submitted before midnight this coming Monday, November 23rd. I'd like to go on with some acknowledgments. The National Association of County and City Health Officials, or NACCHO, provided us with grant funding that made this conference possible, so thank you very much to NACCHO. I'd also like to thank the Indiana State Medical Association, who walked us through the process of the CME opportunity every step of the way, so thank you. Next, I would like to thank Relink. So I was intent on having this conference be in person. It was supposed to happen June 3rd. The pandemic made that impossible. I shot for later in the year. Again, in person, impossible. I was put into contact with Rob Holland from Relink, and he traveled to Indianapolis this summer and demoed their technology. I was impressed at that point, and I have continuously been impressed with the ease of which they have tackled this complicated process. So they've made each presenter look and sound their very best, and they have created a seamless conference experience for you. And I'm sure that you'll be pleased with it. So thank you, Relink. I'd also like to thank each of our presenters who have put in a lot of time and effort to spreading education about opioid safety and alternatives. Your passion really showed through, and we appreciate your time. Lastly, I would like to thank our Planning Committee Technical Chair, So when I proposed this conference, I really had a good idea of what should be in the agenda, but I certainly had no expertise to fully develop that curriculum. And so I reached out and contacted Dr. Shashank Dave, who eagerly accepted the challenge of doing so. We've worked together over the last year to bring you today's curriculum. So thank you. Now it is my great honor to introduce you now to Dr. Shashank Dave.
Wow, what an amazing year it's been. This is finally coming to fruition. I'm so excited. As I reflected back looking at my emails early on with Tammy Nelson from the Marion County Health Department, this is about a year ago. My partner, Dr. Whitney Pratt, had asked me to do this symposium. This occurred shortly after the departure of Dr. Palmer McKay. Dr. McKay and I worked together for years at Wishard. He was working in the pain department and I was working in the physical medicine rehab side, and we had many mutual patients together. I learned early on in my career how important it was to have great mentorship, and I found that with Dr. McKay. When Dr. Pratt asked me to do this symposium, I jumped at the opportunity, and my luck from there just kept improving as I met Tammy Nelson from the Marion County Health Department. I've grown to admire her drive and her acumen. She's been so easy to work with, responsive, and so committed to educating and disseminating treatment alternatives for all of our providers in the midst of not only opioid epidemic, but also the COVID-19 pandemic. I also wanted to thank all the grant sponsors to make this project possible. And I also wanted to thank all the presenters and all the hours of tireless preparation in making this such a special event. Lastly, I wanted to thank my wife, Veronica, and my 2 kids for their patience in putting up with me as I worked on this project. I'll hand it over to Tammy. Thank you.
Thank you very much for your kind words, Dr. Dave. It's been a pleasure to work with you. Now, I am very pleased to introduce you to the Director and Chief Medical Officer of the Marion County Public Health Department, my boss, Dr. Virginia Kane.
Hi, I'm Dr. Virginia Kane, Director and Chief Medical Officer for the Marion County Public Health Department. It is my pleasure to extend a word of welcome to this Opioid Safety and Alternatives Conference. In the last decade, we've learned a lot from cross-cutting research and new approaches to addressing this opioid crisis, especially in this era of coronavirus pandemic, where we've had to adjust practices. But the 2 questions that arise related to us are prescription opioids part of the problem here? And how can we reduce prescription opioid mortality in Indiana? So when we look at the data related to Indiana's overdose mortality rate, we've seen a significant increase just in the latter 3 years, where we're seeing almost triple the amount of overdose mortality rate related to prescription opioids as opposed to our illicit opioids. And of significance, it is so important for us to reduce this prescription opioid mortality, and there's several factors that can make a huge difference. And that is, number 1, we've got to reduce the stigma. If we do that, medical professionals are more likely to screen and refer. But even more important than that, patients will feel more comfortable speaking up, talking to their medical provider, requesting assistance. We must stop using opioids as a first-line treatment, and we need to prescribe using current standards only, and co-prescribe naloxone with all of your opioid prescriptions. Lastly, investigate and utilize these new cross-cutting treatments, alternative treatments, such as physical therapy and biophysical agents, thermal, mechanical, electromagnetic, even light and acoustics have played major roles in reducing prescription opioid mortality. But peripheral nerve stimulation, regenerative medicine, and psychological approaches to pain has made tremendous gains and are favorably impacting our prescription opioid mortality. So I look forward to a robust discussion related to opioid safety and alternatives, and hope to learn from all of you. Enjoy the conference.